Good day, my name is Charles I. Baguio and I'm from BSN 11L of Davao Doctors College, and today I am going to assess the anterior and posterior thorax, and for this evaluation of thorax is an essential component of a complete physical examination and a traditional systematic approach. It involves the inspection it's to be followed by the palpation, percussion, and escalation of the both anterior and posterior parts. The assessment helps us to determine if the patient has any abnormalities, and so first thing we do is that review the previous medical records and if it is available. So for now, I need to prepare the necessary equipment, which is the stethoscope, marker, measuring tape, and the sterile gloves, and also the patient's gown. Before doing the assessment, do the hand washing or the hand hygiene to prevent the spread of microorganisms. So before doing the assessment with the patient, introduce yourself, identify the clients using the two identifier, such as the name, birthday, and age. Ask the client what would she likes to call her, and of course explain the procedure to the client on how she can participate during the assessment. Then ensure the client's comfort and privacy and confidentiality. Then let the client be comfortable. Okay, ma'am. My name is Charles Baguio, your student nurse for today. May I ask your name?
Althea,
Age?
15,
Birthday?
June 10,
What do you want me to call you?
Thea.
Okay, Thea. Okay, so before that, I have some questions. Do you feel chest pain?
No,
Do you observe breezy of breath?
no,
Do you have problems in breathing?
no,
Okay. Do you have any questions or clarifications?
no.
Okay, so let's start the assessment. For the chest and respiration, check the size of the respiratory distress and problems of the oxygenation. Observe for the color and face, lips, and chest and fingernails, and palpate the suprasternal notch and note the position of the trachea. Okay, ma'am. Can you have a deep breath? Inhale. Exhale. Inhale. Exhale. Okay, so I will observe the color of your face and your lips and your chest and your fingers. Okay. Can you see your fingers, mom? Okay, thank you. And now, can you turn to the left side, ma'am? Ay, ano lang, ma'am, anak. Can you look to the yes, ma'am. And to the right side, ma'am. Okay, thank you. And for the examining of posterior thorax, first inspect for the configuration, while the client should stand with her arms and with the sides stood behind her. And then the client then observed for the scapula and the shape of the configuration of the chest wall. So Thea, is that okay that I'm going to touch your chest?
Yes.
Okay. Can you turn around for me? Okay. Can you balik na, ma'am? Okay, for the second one, inspect the spinal alignment for deformities, and from the lateral position, observe the three normal curvatures such as the cervical, thoracic, and the lumbar. Okay, can you please turn around, ma'am, for me? Okay. So for the spine or scoliosis, observe the standing client from the rear and have the client bend forward at the waist. Okay, ma'am, can you stand up? Can you bend like you're tying your shoelace? Bend dito na. Murag ka nang nagkuan ka, ma'am, murag nagtarong ka sa imong shoelace.
Ano?
Oh, like that, ma'am. Sige, anak, ma'am. Okay. Okay, ma'am, thank you. You can sit down. Okay, for the third one is to palpate the anterior thorax. Palpate or the thorax area for the bulges, tenderness, or the abnormal movement. Can you please turn around, mom? Okay, for the next one is to palpate the posterior thorax for the respiratory expression face. Both of your hands to the lower thorax and stretch the lateral ask the client to deep breath and then move and then observe the movement of the hand. Stretch your animal. Okay, So the fifth one, the thorax for the vocal tactile fremitus, it is faintly perceptible vibration in the chest wall. If the client speaks place in the palmar, the surface of the fingertips to the posterior thorax starting near to the apex, ask the client to repeat the word 1, 2, 3 and blue moon. Okay. Can you please say 1, 2, 3?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. Now blue moon, ma'am.
Blue moon.
Okay, thank you for that. For the for the sixth one is to percuss the posterior thorax as the client and bend the head and cross the arm forward and across the chest. Percuss the intercostal spaces about the 5 centimeter internals into the systematic sequence, accompanying the one side with the lung. Percuss the lateral thorax and every few inches, starting at the axilla and working down to the 8th grade. So for the seventh step is to measure the diaphragmatic excursion. Use the percussion to identify the level of the diaphragm and measure the diaphragmatic excursion. Percuss downward from the above the expected level of the diaphragmatic dullness until the dullness is definitely heard. Then mark the level of the expiratory. Okay, mom. I'm gonna ask you to breath. Inhale and exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Okay, for the eighth procedure is to auscultate the breath sound, auscultate the thorax using the diaphragmatic of the stethoscope, because it is the best the best sound with a high pitch breath sound. Now, while doing the percussion, use the zigzag procedure. Mom, can you please inhale, exhale? Okay, thank you for that. Okay, for the ninth procedure is to auscultate the breath sound, bronchophony, as the client to say 99 while auscultating the chest wall, agaphony, and ask the client to say E while auscultating the chest and chest wall, and ask the patient to whisper 1, 2, 3. Okay, ma'am, can you please say the word 99?
99, 99, 99, 99, 99.
Okay, thank you. And can you please say E, E, E? And can you please whisper 1, 2, 3?
1, 2, 3.
Whisper, ma'am. Okay, thank you for that. So for the okay, so we proceed to the anterior thorax. First is we inspect the breathing pattern and inspect the costal angle and the angle at which the ribs enter the space. Okay, ma'am. So can I touch this part of your body? Okay. So now we palpate the anterior thorax. Using the finger, palpate the tenderness of the sensation and start palpating with your hand positioned over the left clavicle. And then left to right, comparing the findings bilaterally. Move your hand systematically downward to the midline, and then level of the breast and outward, and the base to include the lateral aspects. Repeat the sequence in the palpitory for crepitus and fremitule, and in the anterior thorax. Okay, ma'am. I am going to palpate the lower of your breast. Okay, so now we proceed to the palpate of the anterior thorax, the respiratory excursion. Place your palms, both of your hands, on the lower thorax with your fingers laterally, along the lower rib cage, and your thumbs along the costal margins. Okay, ma'am, so thank you. And now we begin to percuss the anterior thorax systematically. Okay, ma'am, can you please lay down? Okay. Okay. Ay, ma'am, please, can you please like that, ma'am. Begin the percussing above the clavicles in the supraclavicular space and proceed downward to the diaphragm. Okay. Can I touch your hair, ma'am? Okay. Okay, thank you for that. You can sit down, ma'am. Okay, so for the last part of assessing the anterior thorax, auscultated for the anterior breath sound, adventitious breath sound, and the voice sound. The anterior thorax now place the diaphragm of the stethoscope that firmly derive on the anterior chest wall. Then auscultate the apices of the lung, and slightly above the clavicle to base the lungs, and at the sixth rib, ask the client to breathe deeply through the mouth and an effort to avoid the transmission of sound that may occur with the nasal breathing. Listen at each site for the list 1. Complete the suspiratory cycle. Listen for the normal breath sounds and adventitious breath sound. Okay, ma'am. I will now assessing your thorax. And breathe using your mouth. Okay, thank you for that. So now, after doing the procedure, summarize all the information obtained during the working phase and discuss the finding to the client and provide the client to clarify anything or everything, and thank the client as the interview ended and perform the hand hygiene. Okay, so about your assessment, I am going to read what are the findings. So regarding to the surveying of your chest and respiration, no respiratory distress or problem with your oxygenation. It means normal and good. So in the examining of your posterior thorax, your spine is systematically aligned, spinal column is straight, and then the respiratory shoulders and hips are at the same height. And of course, during the palpation of the posterior thorax of your skin is intact, and your temperature is uniform, and the respiratory excursion you have is full of systematic storage and expansion. So for the thorax buccal fremitus, you have the bilateral symmetry of buccal fremitus and heard clearly. So during the percussion, you have a normal and it is good. So for the diaphragmatic excursion, the vesicular or the bronchovascular breath sound. Auscultated breath sound, you have a quiet rhythm and effortless respiration. So in assessing the anterior thorax, one pump it until your thorax, and it is a full systematic. So during the request resonate, so it is good. And then during the broadcast of the resonate sound, this is rib flat over the area, and heavenly muscle down on the areas over the heart, and the sympathetic over the underlying stomach. So in the auscultating the anterior thorax, you have a adventitious breath. So your finding shows it is good and it is so normal. Okay, ma'am. I have something opinion to you. Don't forget to do exercise and stay healthy for all the time. And do you have clarification and concerns, mom? No? Okay, so thank you for your time and effort, Thea. And this is the ending of the assessing of thorax. Thank you.